Like counting the seconds? Okay, perfect. Okay, my name is Carly English, and this is my honors mentorship final project. I entitled it A New Approach to a Growing Problem. So my background for this project, one day I was scrolling through Facebook, as you do, and I saw an article, and it read, the amount of children currently diagnosed with ADHD has risen approximately 7% since the 1990s in the United States alone. And through honors mentorship, I'm able to intern at Kids Health, which is a pediatric office. And so after reading that article, I became curious, as to how many children in that office alone had ADHD. And so I began paying close attention when I'd be at my internship, and I started noticing papers that were lying around regarding children who had ADHD. And the most recurrent form I saw was a teacher evaluation, where it had to be filled out by the teacher of the child that was being evaluated. And so one day I decided to read the questions that were being asked. And as I was reading this seemingly endless list of questions that the teacher had circled yes to for this particular child, I started thinking, what could be the reason for this tremendous jump in the amount of children with this? And I started thinking, could it be the chemicals in our food, or could it be lack of discipline from parents? What is it? And so this got me thinking even more, and so I began doing research and found something that was even more interesting, and that was that the medications that these children are being prescribed for this disorder are almost worse than the disorder itself. The amount of side effects associated with common prescription drugs for ADHD, such as Vyvanse and Adderall, are extensive, and they include decreased appetite, sleep problems, and moodiness. Those are the top three that people say their children experience. And so after reading this, I began to think, could there be an alternative way to treat ADHD that would be harmless and not have side effects on children? And I personally believe in the power of natural medicine. And so with the emphasis on natural products in recent years, everybody, it seems, is going vegan or going raw or whatever. I started thinking, could there be a natural way to treat this disorder? What child should have to endure these side effects when there's a harmless way to treat it? And so these thoughts led me to the question of, could attention deficit hyperactivity disorder, or ADHD, be treated through the use of natural methods rather than pharmaceutical drugs? And so prior to beginning my research, I didn't really know enough about ADHD to even get my project started. I had friends in elementary school who took medicine for it, and I have a few now that still do, but other than that, I didn't have really any information on ADHD. And I did know that there had been a significant jump in the disorder, and I personally assumed it was from a lack of discipline from parents, and they just wanted a quick fix for their child, so they were going to give them a pill. And I also knew the two most common drugs used to treat this, Vyvanse and Adderall, and I did know that they had side effects. But other than that, that was pretty much it. But through research, I was able to assemble an essential question that would produce a definite answer. So, in my search to answer my essential question, I read countless articles, and I made annotated bibliographies for those, and I browsed a lot of different websites, on ADHD and natural medication, and I even conducted an interview with my mentor. So my first source was an article that I found on Galileo. It was an ebook entitled Signs and Symptoms in Pediatrics, and I found this source before I even knew that I was going to do my project on ADHD. I knew I was going to do it on pediatrics though, because that's the field I want to go into, and this source includes general information that any pediatrician or anyone doing research on pediatrics would need to know, and it's designed to help work through patient problems systematically and effectively. And it basically just explains different signs and symptoms that children will present with that adults may not, and then different illnesses that could be, that they could have when they present with those symptoms. And this was useful because, as I said, I'm interested in pediatrics. So my next source was also found on Galileo. It's an article as well, and it's entitled Meditation or Medication, Mindfulness Training versus Medication in the Treatment of Childhood ADHD, a Randomized Controlled Trial. And At this point, I did know I wanted to research ADHD, and I knew that I wanted to look up natural methods for it. And so this particular source examined the effect that ADHD medicine has on children, and it raised the question of, are these drugs the best way to treat this? And it described a plan that was developed called mindfulness training. And by definition, mindfulness is the psychological process of bringing one's attention to the internal and external experiences occurring in the present moment, which can be developed through the practice of meditation and other training. So mindfulness training is meditation, basically. And for this particular study, 579 children were randomized throughout the course of 14 months. Some were put on like Vyvanse or Adderall. Some were like given mindfulness training, like that was their treatment that they were given because of their diagnosis. And then some were put on a combination of both. And the study showed that the children that received both treatments showed a larger decline in ADHD symptoms compared to those just receiving the behavioral training. And moreover, the combined treatment didn't have any additive effect than just the medicine. So this one really it just said that the mindfulness training didn't help, but also didn't hurt. And so it was helpful because it was a different type of treatment that I could look into. That one was good. And then another source I found was on Galileo. It was also an article entitled Natural Product-Derived Treatments for Attention Deficit Hyperactivity Disorder. And this source analyzed a study that reviewed the herbal preparations and nutritional supplements as potential ADHD treatments. And so one quote from this one I really liked said, "The botanical agents discussed in this study appear to be promising ADHD treatments, considering their therapeutic effects and negligible negative side effects. Nevertheless, it has to be noted that ADHD is a complex disorder having multiple causes, and thus the use of natural derived treatment alone may not sufficiently affect consistent change in ADHD symptoms." So this one pretty much said that ADHD can't be treated through just natural things. It has to have a stronger approach such as medicine. So this one made me curious to know as to why even medical professionals don't think that ADHD can be treated, like why natural treatment's still out of the picture. And even the quote said that they seem to be promising, but it seems almost as if nobody's really looking into it as much as needs to be. It seems like people, they don't want to put in extra time it would take to find a different way. They just want to give their child a pill and be done with it and send them on their day. And so this one was useful to me because it showed that they are promising, people just aren't seeming to want to look into it. So the last source of information I got was from an interview that I conducted with my mentor. Her name is Sam Barnes, and she's the nurse at Kids Health. And I asked her 10 questions, and I included 5 of the most important ones. The first one said, I asked her if she would say that the amount of children with ADHD has increased or decreased since she's been working at Kids Health. And she said that she'd definitely seen a large increase, and she said, even went as far to say that there are 3 times more kids now who have ADHD than when she started, and that was 26 years ago. And so I thought that was pretty interesting. The next question I asked was, ask her why she believed this trend was occurring. And similar to what I think, she says there's a definite lack of discipline from parents, and they're looking for a quick fix to their child's behavior, so they seek a diagnosis in medicine instead of doing their job as parents. So another question was, do the parents complain of any side effects their children have? And she said yes, a decreased appetite, moodiness, and they can't sleep. And those are the top 3 side effects that usually come along with the typical drugs given. And Dr. Holsey is the doctor at Kids Health, and I asked her if she had ever tried prescribing a natural method treatment. And she said that she's tried an over-the-counter medication called Calm Child. And Calm Child, it's like you can get it at the Good Nutrition store or something. It's not so much of actual medicine, but it can be given as a tablet or a liquid, and it's like a special herbal blend that's designed to soothe the bodies and minds of children. And in different cultures and around the world, that combination of like herbs is used to promote alertness and focus in children. And another natural thing she had tried was putting children on the Fingold diet, which is an elimination diet, and some things it eliminates are artificial food coloring, artificial flavors and fragrances, artificial sweeteners, and 3 different preservatives. And with that diet, it's first used as a diagnostic tool to see if any of those eliminated items are triggering some of the problems that are being seen in the children, and if it's successful, it can be continued as treatment, and it can also be combined with any other necessary medical treatments. And the last question I asked her was if she had any additional comments about ADHD, and she said that she feels that if there was more parental involvement in children's education and less use of electronics, that there would be a lot less problem with ADHD. And I definitely agree with this, just like she said. And so this interview was very insightful because it was good to hear opinions from someone who deals with ADHD on a regular basis. So I thought it was a pretty good source of information. And so to conclude with my presentation, prior to my research, I thought that ADHD was simply just a discipline disorder that could be corrected through proper parenting. And while this is true for many children, I now know that there are a large amount who do have difficulty focusing regardless of attempts from parents to correct their behavior. And I also learned that the common drugs used to treat ADHD have even more side effects than I thought. I still believe that ADHD in children could be corrected through purely natural methods, but I now know that some children may require a stronger approach. And so instead of my focus being solely on the use of natural methods, it's now shifted to include the use of prescription drugs along with those natural methods. And I believe that doing this would lead to improvements in that child's ability to focus, and it would also lower the side effects of the medicine tremendously. And this could also eventually lead to eliminating the prescription drug altogether as the dosages were lowered and the natural